Faculty have developed this brief voiceover PowerPoint to provide you with an orientation to your Week 5 simulation experience for next week. This simulation is designed to help you prepare for your upcoming long-term care visit later this month and for your actual hospital-based clinical experiences in the fall. Simulation is based on the truth in this Chinese proverb, "If I hear, I will probably forget. If I see, I may remember, but if I do, I will understand." And understanding is the foundation of nursing. You may have participated in formal simulations in your previous academic studies. We use simulations in virtually every clinical course in the AE curriculum, and this is how we understand learning through simulation. A simulation is a technique that uses a situation or environment created to allow persons to experience a representation of a real event for the purpose of practice, learning, evaluation, testing, or to gain understanding of systems or human actions. We also use debriefing time extensively in nursing. Debriefing is a period of structured discussion shortly after completion of a simulation in which participants incorporate prior learning with learning that occurred during the simulation for the purpose of transferring learning to future situations. Since this is your first simulation in the School of Nursing, we wanted to share some premises or assumptions that we adhere to. Simulation is designed and controlled to be a safe learning activity where you can practice complex or challenging skills. It is designed to be a safe place to practice, where you can make mistakes and correct those mistakes. Identify aspects of your practice that may not be safe, but you can make them safe, and for you to try on different roles. It is a safe place to learn complex or challenging communication or psychomotor skills. Do not be afraid to practice in simulation. It is a safe learning place. Simulation is for learning and practice for you to develop confidence and mastery. That means that you need to practice adult learning principles. You must identify your personal learning goals. You must be involved in self-evaluation, and you must be willing to repeatedly practice skills and procedures. What happens in a simulation area stays in a simulation area. We will frequently use simulated patients. Those are real people, volunteers, who are willing to share details of their lives for your learning. This simulation is considered a clinical area, and what you learn about another individual during simulation is protected, confidential information and does not leave the simulation area. You will hear faculty talk about reflecting in action, where you are involved in self-monitoring during the actual simulation, where you need to ask yourself, am I observing? Am I processing? Am I remembering what I need to observe or process or remember? During our simulation and in some future simulations, you will have a partner to help you develop that skill. Your buddy who will be the observer can help remind you of what you need to observe or remember. You will also hear faculty speak of reflecting on action. That means that you engage in conscious review and analysis of the events of a simulation after the fact. And that is the purpose of debriefing. But you should also include in your practice personal reflection away from the setting Only you can improve your practice. The primary objective for the Week 5 simulation activity is for the student and partner to identify specific components of a client database as a starting point for the planning and implementing of nursing care for a simulated patient, Mr. Robert Bailey. You will meet Mr. Bailey and learn details about him in a different document. But a client database is a collection of patient-related information that serves as the basis for the nursing process. You will be learning much more about client databases in the long-term care simulations in the next few weeks. So what we are doing in Week 5 is a skeleton of a client database as the introduction. To obtain this client database for Mr. Bailey, you will collaborate with a student partner to complete a focused patient interview or history using therapeutic communication techniques. And together in the dyad, in the pair, you will complete a focused physical inspection using correct physical assessment techniques. The simulation will involve 1 hour of your skills lab day during Week 5. Make certain that you are in uniform with your name badge. Report to room 4.106 at your assigned time and see information from your instructor about your assigned time for your simulation. Plan to work in a dyad or a group of 2, rotating roles of the nurse and observer. One nurse will complete a patient interview while the observer makes notes and prompts. The patient interview using the provided guideline is allowed 20 minutes. This interview will involve a mannequin in the bed with overhead voice from the control room. Students will then rotate roles and move to an adjoining room where there will not be an overhead voice, so the nurse cannot ask questions, but the control booth can hear conversations. The assessment nurse has 20 minutes to complete the physical inspection. The focused interview of Mr. Bailey should include questions to elicit the following information: mental status, including level of consciousness, orientation, recent and remote memory, current or real-time health and post-op surgical status as understood by the patient, current or real-time pain status, elimination status, asking about passing gas, his last bowel movement, voiding patterns, and any changes in that, recent eating and usual dietary habits, including problems with chewing or swallowing, or any changes in appetite. Also, as the patient understands it, current status regarding getting out of bed or needing ambulatory aids. Remember to avoid yes/no questions unless that is the only desired answer. And remember that it may take a little longer to ask some questions if Mr. Bailey seems confused or disoriented. In addition, the interview should include questions that will help the dyad, you and your partner, complete a Braden scale and a Hendrick Fall risk scale, and you will have access to a paper copy of these 2 scales. After 20 minutes, and there will be a timekeeper, you and your partner will move to an adjoining room to determine the following information from a high-fidelity mannequin, but with no verbal contact. You will need to assess vital signs, including TPR, blood pressure, pulse ox, pupil status, cardiac assessment to determine rate and rhythm, and you will need to auscultate in 5 primary sites. You need to assess for apical radial pulse deficit and capillary refill, and we'll need to do a thorax lung assessment, anterior and posterior, to determine rate and rhythm, and to describe breath sounds heard in the assessed areas. In addition, you will need to complete an abdominal assessment to describe the shape of the abdomen and bowel sounds in all quadrants. Assess the lower extremities for pedal pulses, presence of any pretibial edema, and any areas of skin redness or breakdown. And you will need to make notes and describe the site and appearance of any incisions or wounds or dressings or catheters or drains or IV sites. The dyad will then have 10 minutes to debrief or talk among yourselves about what went well, what did not go well, what did you skip. You'll need to make notes on the client database form. You will need to bring this to class on Friday morning. There will be no EHR documentation for this simulation. When the timekeeper signals, you will then move to your next assigned room, and all groups will meet in 4.180 at 4 o'clock for a formal debriefing about the entire simulation experience. Please see information in the Week 5 module to introduce you or give you information on Mr. Bailey and additional readings that may help you prepare to interview or assess Mr. Bailey. You are coming together as a cohort, and that is the beginning. And now, as a simulation group, you are keeping together and making progress. The ultimate success is working together throughout the summer and next year in various simulation activities. I hope you look upon the simulation experience as an exciting opportunity to learn, realizing that it is a safe place to learn.